Hi, I'm Dr. Carter, and in this chapter, we're going to do chapter 7, which is assessment of higher level learning, assessment of critical thinking. And we're going to look at how to effectively evaluate critical thinking, problem solving, and clinical reasoning skills. Let me go ahead and share my screen to the current PowerPoint. Okay, here we go. Okay, so understanding higher level thinking. Um, it looks at kind of the Bloom's taxonomy of applying, analyzing, evaluating, and creating. So the upper levels, not so much the knowledge base levels. Um, and we can expect our students to apply these to new situations, compare approaches, identify complex patient needs. Um, Helps a lot in clinical practice and in theory. So the principles assessing higher level learning, we're going to look at identifying learner goals, select assessment methods, implement assessment, and providing feedback. The assessment of higher level thinking helps prepare the nurses for complexity and unpredictability that they'll encounter in real world settings. Okay, so specifically in clinical practice, problem solving in clinical practice, um, recognize the problem, so identify clinical issue, gather data, the assessment, um, generate potential interventions, and then evaluate the effectiveness, the ability to problem solve and in setting related issues or places is critical for higher level thinking and therefore critical for us to be able to assess that. It will involve the ability to have a deeper understanding to assess the critical thinking. Okay, factors influencing problem solving ability. So problem solving ability in nursing is significantly influenced by two things: past experience and knowledge base. So exposure to similar clinical problems, whether real or simulated, enhances the ability to problem solve in those future situations. Um, that's why experienced nurses can often problem solve better because they have the experience behind them. So it's really important in our education with students um, to provide these experiences either in clinical and simulation, or even just discussing them in class. Not quite as good, but still trying to give them a little experience. And the knowledge base. Students with stronger knowledge base, theoretical backgrounds, knowledge recall can often identify the relevant information more efficiently when confronted with complex clinical problems. So experience and knowledge base. Types of clinical problems we have: well-structured versus ill-structured. In well-structured problems, they have all the information they need to form a solution. There's typically like one correct answer. They can follow an algorithm of problem solving, require limited critical thinking. In ill-structured problems, it might reflect a more real-life clinical situation, present incomplete or ambiguous information, may have multiple valid solutions, and require complex thinking strategies. um, they have to be able to evaluate the basic knowledge, assess the clinical reasoning, and balance both types. Um, in nursing education, there are both well-structured and ill-structured, providing all the necessary information and then applying it to real life where all of that is not maybe readily available. Okay, so critical thinking in nursing. It encompasses reflective thinking and logical reasoning, analyzing the situations, reflecting on ideas, and evaluating them. It's said that 85% of nursing errors could have been avoided with improved critical thinking. So it's not just necessarily that they got the information wrong, they just didn't think through it critically enough to avoid the error. And it takes years of advanced critical thinking to get to that point. Characteristics of critical thinkers. These are your students that are usually more inquisitive. They ask questions. They seek clarification. They're usually open in nature, like in perspective. These are your students who will ask questions and then listen to the answers and think them through. Not the type of student that's like, oh yeah, I knew that. And they'll look at the alternative perspectives, knowing that they can grow from that. Nursing students who think critically usually demonstrate these type of characteristics. So they question, they have good questions, and they show a genuine interest in learning and being open to that. They're willing to think of different perspectives and think outside of the box. Context-dependent assessment items, also known as interpretive exercises, require learners to analyze and interpret introductory material before answering related questions and completing specific tasks. So, for example, you give them a clinical scenario or data. They have to analyze it and interpret it and complete questions or show learning based on what you've given them. So that's context dependent. Examples of these, like standard questions on multiple choice content, hotspot items, which these assess spatial understanding and identification kind of skills. You might have an image on a test where they have to label it or describe what they're looking at and how it relates to the question. Looking at charts or exhibits, something context-based. The NCLEX incorporates context-dependent items as alternate format questions to assess higher level learning. So we do need to be able to understand what these are, how to bring them into our classrooms, because they will be doing it on the exams. So like picture identifications, charts, graphs, clinical documentation. It's a specific set of information that they can then derive higher levels of thinking from. So example of a hotspot item. Examine the fetal monitoring strip carefully, noting patterns and variations of tracing. To apply the knowledge, they would have to recall the characteristics of contractions or on monitoring strips, including baseline, aptitude, duration, and precisely locate the beginning of the contraction by clicking on the exact point. And then the strip, they might click on the strip, like on the exact point. And this is a representation of a hotspot item. Advantages of context-dependent items. You can simulate clinical, make sure they understand situations, kind of closing that gap between knowledge and practice. It can be standardized. You can provide all the students with the same scenario and see their process of thinking. It gives more of a comprehension and application context in your testing rather than just memorizing, and mirrors reality better. This is the kind of stuff you're going to see in real life, not just on an exam. So using that kind of context-dependent items makes it more realistic. Instructional challenges, limitations on context-dependent items. They're hard to make. You have to be careful that the introductory material you give into the context is enough for them to answer the question, but not enough to give away the answer. Specific training for this is often very helpful. And the students have to be able to be good on their reading and writing. Your ESL students might have a little harder time here. But they have to be able to read, write, distinguish, possibly complex clinical scenarios. So just to keep that in mind when you're writing these type of questions. Yeah. So types of introductory material you might put in a complex question, context dependent item. It can incorporate diverse introductory materials to establish the realistic clinical scenario. And you might be describing a clinical situation or providing patient data sets, maybe some research findings or issues in clinical practice. You can also use excerpts from reading materials, visual diagrams, tables, images, graphs, any of that kind of stuff. So an example, clinical situation as context. You call the pharmacy about a medication and learn the amount ordered is twice the usual dose. You contact the physician who tells you give it anyway, the patient needs it. So question 1, what are your options at this time? Describe advantages and disadvantages of each. Question 2, how would you solve this dilemma? So this example uses a realistic clinical ethical dilemma as context for an assessment. And the scenario presents a medication dosage concern, followed by physician instructions that conflict with safety standards, creating a complex situation requiring critical thinking. So the students would have to identify multiple options, demonstrating divergent thinking, evaluate each option's advantages and disadvantages, which is analytical thinking, and then apply ethical principles and professional standards to resolve the dilemma, which is evaluative thinking and decision making. So this type of question, even though not really difficult to write, makes them think in a variety of different ways very critically. Diagram as a context-dependent question. This is an example of using a diagram. You might have anatomical identification, functional understanding, and clinical applications. So the students must correctly identify the specific structure within the nephron. Beyond identifying it, though, because that's just knowledge, they have to explain the function of each structure, showing comprehensive physical process, and assess physiological function, pathology, clinical manifestations. So going beyond just labeling and what is this, but what does it do? What can go wrong with it? How would you fix that? What medications might you use? What medications would you not use? Things like that that go beyond just basic knowledge and help them critically think through the process, but by using it as a diagram for context. And NCLEX will do that as well. Okay, writing context-dependent items. Specify the scoring method. You have to tell them what is expected and how you're scoring it. Set response limits, establish clear boundaries. You don't want a 4-page discussion on ethical dilemmas. Just, in 3 or 4 sentences, describe the ethical dilemma related here. Something like that. Kind of set your limits. Create a rubric ahead of time of what you're looking for, and then hold each answer to that rubric. And we'll talk about rubrics later. And vary item types. So don't use the same type each time. Some might be stronger in graphs versus diagrams versus case studies. So just varying it up helps the students in fairness and different lines of thinking, different ways of analyzing the data. Okay. Layout for considerations of context-dependent items. Make sure you use a clear heading. Use distinctive formatting. Numbers are consecutive. Context, it should be visually distinct. Make sure there's extra spaces before and after each question. Question placement. Keep it all on the same page if possible, if you're using a context-dependent item. So for example, if you have the fetal monitoring strip, try and keep the questions to that strip on the same page, not, when is the beginning of the contraction for the strip, and then on the next page you have the questions for it. Setting up your exam in a clear format like this is extremely helpful and beneficial. We'll talk more about that later, but just to touch base on it here, make sure that when you're using context dependent, you try and keep these ideas in mind. Okay, alternative assessment strategies and methods. Perspective questions, asking students to analyze from multiple viewpoints. It can help comprehensive understanding and also maybe some ethical or empathy. Higher level questioning, make sure you incorporate questions that require analysis, synthesis, evaluation, not just simple recall. Push them deeper. Clinical reasoning, design evaluations that require students to think through complex clinical situations and have them explain their rationales. So you can't just choose this answer or write down this answer. Why? Why did you pick that? Explain it to me. I'm not saying it's wrong. Tell me why you did it. Sometimes it is wrong. You still want to know why they did it, right? Okay. So incorporating higher level questions throughout assessments challenges them to move beyond simple recall to the analysis, synthesis, and evaluation. Okay, that's all for part one. See you in a minute.